Marcy Lundy, and today on Beauties Aging Gracefully, I'm very excited to have on Dr. Suzanne Quardt. Welcome to Beauties Aging Gracefully, Dr. Suzanne.
Thank you so much. What an honor to be here. I'm so thrilled to get to meet you and speak with you and chat with your beautiful audience.
Yes, I'm so happy to have you on. Every time I look at you, I told you beforehand, you remind me of one of my favorite people ever, Jillian Barbery. So it's like,
And I'm so honored that you said that, especially since I'm getting so up there. So
well,
thank
you look
you.
absolutely fantastic.
Oh, thank you so much. That's so
Yeah,
kind of you. Thank you.
well, you're welcome. So to
I'm in
start,
a good business for
you
trying to
are,
still looking okay.
and you're in sunny Southern California. It's doing you right.
Yes, yes.
All right, Dr. Suzanne. So before we get started, I was wondering if you could tell the audience a bit about your background, as well as what led you to specialize in cosmetic and reconstructive breast surgery.
Okay, so basically, it's weird. I didn't always know I wanted to be a doctor. And the reason I say that is in the third grade, I wrote an autobiography. So you can imagine how short that was. But my mom saved it and it said future doctor. And I drew like a stethoscope and stuff like that. So believe it or not, and I think my mom was a great, she was a math teacher. And I think she was a great influence in that she encouraged me to study and I know she wanted me to become a doctor, but it wasn't like she had to force me because I really wanted to. So I always knew that.
Okay.
But I thought I was going to be a pediatrician because I loved kids.
Oh,
And what happened was just through my years of schooling and training, I realized that I actually had more the mindset of a surgeon because I was very I wanted like a skill that I could have, right? And I found out that I was skilled with my hands. I used to play classical piano and I just like doing things with my hands. And I wanted a skill that might set me apart, from another surgeon or doctor. I didn't necessarily think I was going to be a surgeon at the time, but what happened was I did get more into surgery when I was in med school. And then I was gung ho, thought I was going to be a cardiothoracic surgeon. So I wanted 100% to be a heart surgeon. So I actually did a sub internship at Columbia University in New York City when I was a med student, and I got a letter of recommendation from the now very famous Dr. Oz when he
oh
was
my
still
goodness.
a professor there. And
Yeah.
I worked with the transplant team, and I got to go in the helicopter and harvest hearts and lungs and get to
Oh,
do all that exciting stuff. And I was like, yes, this is what I'm going to
amazing.
do, right?
Yeah.
But I can say that I do believe that that letter helped me get accepted to USC in Los Angeles for general surgery.
Okay.
So I was on track for, going into cardiac surgery. I even went into the lab and did cardiac transplant research for 2 years.
Okay.
But the funny story is when I was an intern, plastic surgery was an intern rotation. So I did it. I was fascinated. They did microsurgery, they did reconstruction, they did everything from like head to toe. I was like, wow, they're really very skilled and amazing and technically proficient.
Mm.
And then I became a second year resident and they made plastic surgery a second year rotation. So I did it again. And because I had done it before, I was pretty good at it, right? Then I became a third year resident and they made it a third year rotation. So I was like, I'm getting pretty good at this. But the point is, I really got to know the faculty and the professors, and they were great mentors. And I started to realize that I really did like plastic surgery, and I just didn't know what they did prior, right?
Okay. Yeah.
And it was so I mean, plastic surgeons do anything from like congenital malformations in children to breast cancer reconstruction to
Yeah.
reconstruction after trauma and injury. So it's so comprehensive, you can't get bored, right? I mean, there's so many body parts and things that
Yeah.
we can do. So
Right.
what happened was in the laboratory in my second year, I decided I wanted to go into plastic surgery. So
Amazing.
that's how that happened. And then I was fortunate enough to be stay aboard there at USC and train with my mentor, Dr. Sherman, who was the chief of plastic surgery at the time at USC, and that's how that all began. And he was actually a specialist in breast reconstruction, so that's where I got a lot of my training in breast reconstruction.
You are quite impressive, Dr. Suzanne.
Oh,
That's
you're so sweet. Thank
amazing.
you.
Yeah, that's absolutely amazing. So you've been named top doctor for 15 years and featured on Dr. 90210. What has been the most rewarding aspect of your career?
You know, it might sound corny, Marcy, but it's all of
Mhm.
it. And the
Oh,
reason I say that is the older I get, my career has evolved.
right.
So, when I started out, I did a lot of reconstruction, whether it was for breast cancer. I did these complex flaps for spinal cord injury patients. And I used to do a lot of burn reconstruction for people, who needed that type of stuff.
Yes.
And all of that, as you can imagine, super rewarding, right? But then as I got older, I was meeting patients like a mom of five who, she complained that her breasts were sagging to her belly and her tummy was stretched because she gave her life to her five kids.
Oh, yeah.
And
Yeah.
so then, to be able to do a mommy makeover and bring her, at least back to where she used to be, but oftentimes even better, which is really fun. I
Yeah.
love that.
Yeah.
Meaning like even a flatter tummy and, fuller, perkier boobs than when
Yeah.
she even started. Um, how rewarding is that? And then,
Amazing.
evolving even more. Now I do a lot of facelifts and eyelid surgery. And, the older I get, the more I appreciate when you want a little nip
Yeah.
tuck and to be able to do all that. So, so that's why I say that, because it's evolved and I've loved all of it. And I think that's why I love what I do, because it's all so much fun.
Oh,
Um,
sure.
the TV was a blast. I can't lie.
Yeah.
I
Yeah.
mean, there's nothing like it. So, people like you and other people who've had that experience to be both behind and in front of the camera.
Sure.
I have to say that I thought I'd be, really nervous and stuff, but I really enjoyed it. It was fun. It was a
You're
lot
so
of fun.
personable and so
Uh,
sure that was.
So, I enjoyed it. I enjoyed it. And the reason I really liked the Dr. 90210 is a spin-off of the older Dr. 90210, but this particular series had all female plastic surgeons.
Oh,
So
that's
I loved that angle, right? I mean, being
so
a
good.
female plastic surgeon. So to me, that was such a cool twist and a cool angle. Unfortunately, COVID then happened and we had only gotten one season, but
Oh,
interesting enough, we did just shoot a little while ago now, but a pilot for another TV show that
okay.
Kelly Ripp was the executive producer. So it's called Mothers and Daughters Under the Knife, and it hasn't been picked up yet. So, but it was supposed to be for Lifetime, and then we TV showed interest, but so who knows what's going to happen with it? I'm just going with the flow.
Yeah.
Everything's changing so much with television nowadays, right? In Hollywood. So we'll
It's
see what happens. But if I'm blessed enough that something comes to fruition with that, it would be fantastic.
Yeah, that actually sounds great. As you were talking about the mom of five, I was thinking about a friend from high school, and she had a mommy makeover, and she looks absolutely stunning. So it's like, what a reward after you've given your body, to these.
Yes.
To,
And I have one, Marcy. So
yeah,
any woman who has, I mean, one or more, I'm
yeah,
like this, like hail to you,
right.
because it's hard.
My friend has six, and she looked
Oh,
great
wow.
before, and now she's just the total knockout. So
Yeah. And isn't that fun that you
it
can
is.
restore someone and maybe even improve things a little bit, why
It's
not?
amazing. Yeah, absolutely. So we're seeing a number of women choosing explant surgery. First, can you explain what that is?
Sure. So it really, explant just means removing a breast implant.
Yeah.
whether it's saline, silicone. That's all that means. So
Okay.
it's just our technical term when we explant a
Yeah.
breast implant. That's all that means.
Okay, great. So what are some of the most common reasons that women are opting to remove their implants?
So what I'm hearing a lot of nowadays is women who've had them for many, many years.
Mm-hmm.
And then some either have a problem with them, like they get firm, and that's called the capsular contracture, where it gets hardened,
Oh,
and or they may rupture, whether they're saline or silicone, right? And then they want to get it replaced or removed, or because our tissues change as we age, and sometimes what happens is the implant is up where it was placed, I'm just going to say 20 years ago, and then the breasts continue to age and droop over the implant. And that's actually called a waterfall deformity, only because the breast kind of falls off the implant. And
sure.
so, it doesn't look great. And so they may want to get that fixed. Now, it used to be that people were having them replaced very regularly, meaning let's remove the old implant, put in new ones.
Yeah.
And some people were calling it an upgrade if they were saline to silicone, because the silicone implants have improved over time, which we could talk about at another time or whenever. But saline implants really haven't changed since they were invented. Basically,
Mm.
it's a silicone shell elastomer filled with sterile salt water. That's it. So,
Mm.
but they're very safe, right? Because if it ruptures, your body just absorbs the saline. It's not going to be like a silicone gel that your body's going to react against.
Sure.
So what I'm finding now is that what women are saying, though, that's a little new and a little different, is they're saying, I'm over the implants,
I
and
get it.
I want to be more natural.
Yeah.
And so I really don't want to replace them if possible. What are my options? So that's a newer trend to becoming, removing a foreign body, basically, right? They know
Right.
they come to a point in their life that they realize, or maybe they just feel like they're too big, too top heavy. Their body may have changed. They may have gained some weight from when they first had their augmentation, and they're just ready for a change, and they want them out.
For sure. Yeah, I remember, gosh, late 90s, early 2000s when these silicone stories were coming out. And it was so disheartening because women thought they'd found a way to just make themselves feel better about themselves. So thank goodness to hear this about saline that it doesn't change.
Yeah, and what's interesting is there were many, many years that I didn't even place a saline implant. And the reason I say that is because people were choosing the silicone gels because they felt that they felt more natural,
Okay.
and they
Yeah.
felt more. Because if you feel the difference between a saline implant and a silicone gel implant, the silicone gel implant will feel more like mimic breast tissue, whereas the saline implant basically feels a little more like a water balloon, because that's
Okay.
kind of what it is, right? I mean, it's a high tech water balloon.
Yeah.
Pardon me. But this is an interesting trend,
Okay.
is either women, I'm getting women, believe it or not, Marcy, who've had their saline implants for 30 plus years and
Oh,
didn't have a problem with them. So they're saying, heck, if I'm going to replace them, let's do it with saline again.
yeah.
Or
Mhm.
they're just saying, you know what, I think saline sounds a little safer. I don't have to worry about silicone, rupture in my body in the future. So let's go with saline. So that's also a new trend that
Okay.
that's happening now.
Okay. Yeah, that sounds amazing. So many women in midlife are reassessing their health and their bodies. Are you seeing an increase in patients over 40 in perimenopause that are choosing explant surgery?
Absolutely. And
Is
that's
what you
probably
were
my
saying?
my number one patient population that's desiring explant surgery right now. And
Yeah.
it's because they've had their implants for either it's their first set of implants that they've had for 20, 30 years,
Mhm.
or they've had implants and had complications with implants, such as capsular contracture, which is the hardening,
Yeah.
and they've had them have them replaced a few times, and then they're having a new issue and want to replace them, or they've gotten saggy over time, and they may want to replace the implant for size issue, to go bigger, smaller, what have you, and then get
Yeah.
a lift. and all of, or they may want a reduction because they feel that they're too top heavy. And what's interesting is prior to, which I know we'll get into my Qflap procedure, but prior to that option, um, there weren't a lot of options in terms of if you just wanted to remove them. Women were
Right.
very concerned about becoming very deflated looking, but especially right behind the nipple, because that's where the implant sits. So if you
Yeah.
remove that volume right where we want it most, right, you can get
Mm-hmm.
what I call like a concave in deformity, almost like a ski slope, but it can be rather severe because what happens over time is that implant kind of stretches out and attenuates your own breast tissue envelope.
Okay.
And so, for that reason, then once you remove it, it can really collapse. And unless you do something like either replace it with an implant, but let's say someone does not want that because they don't want a foreign body, unless you do fat grafting or something else. And we can talk about the issues with fat grafting because it's definitely not a perfect procedure. It's an option, but not perfect. Now that I have something else to offer, a lot of my patients are saying, let's do that, because then I don't have to get a new implant, but yet I'll have some of my own tissue behind the nipple to give me some more fullness and perkiness.
Okay. Yeah, then that's important. So speaking of the Qflap, you developed the Qflap procedure for women experiencing volume loss after explant surgery. Can you walk us through how this procedure works?
Sure. So the way I came about it now, the way I think it's all my years of doing breast reconstruction and a lot of breast reductions, because in a breast reduction and all breast surgery, the whole crux of the operation is to keep the nipple areolar complex viable. Okay. And especially like, let's say if someone's very droopy, we're moving the nipple up. And all of these maneuvers, especially once you're removing an implant and there's issues with blood supply. So it's a very and then if you're doing breast lifts or mastopexy along with the operations, it adds a level of complexity. So the big thing is you don't want to kill the nipple. You don't want the nipple areolar complex to die. And it's a real risk that we discuss, whether it's a breast reduction, a breast lift, a breast complex, what I call complex breast revision. Okay. Now, the reason I'm a little more comfortable than maybe some other people, and there's a lot of plastic surgeons who are very comfortable doing these procedures in maybe one stage, but some plastic surgeons stage the procedures is because of this blood supply issue. But when I did my fellowship in aesthetic plastic surgery, I did publish on combining breast augmentation with mastopexy, which is a lift. So there are certain techniques that you can use to really, be careful and ensure that you maximize the blood supply.
Okay.
So just using everything I learned. It's not like I really created something new. It's just an approach, right? I kind of came up because of all the breast reconstructive techniques. I came up with an approach where I was like, we weren't really using a patient's native breast tissues or even local tissues. So someone has rolls in the sides, you can even move those into help fill in the breast, but it can be lengthy scars. Not everyone's a candidate. So that's why the consultation is very important. And also you have to be accepting of scars, but maybe a massive weight loss patient would be good for something like that, right? Who wants to get rid of implants and has rolls on the side, and we can use that tissue to help build the breast. But my technique uses the lower pole. So that's the breast tissue and skin that is below the level of the nipple. So you imagine that's where the breasts are typically the heaviest, right? And in a lift, the traditional approaches would cut through what I call my Qflap. And the only reason it's called the Qflap, not because, I invented something genius. It's just because what else was I going to call? Actually, I was calling it an autologous transposition breast flap. And people are like, what the hell is that?
Right. Right.
The Qflap was just easy.
Yeah. Yeah.
But, pardon me. So I use that tissue and I I approach the breast and the old implant in the capsule in a fashion to avoid disrupting the blood supply of that flap.
Mm.
And then I deepithelialize, which just means taking the skin off that flap. And then I can take out the old implant and capsule, whether it's called en bloc, which just means that you take out the implant and capsule in one piece,
Okay.
or you don't necessarily have to do that in everybody. There's times when you may want to do that, or it's easier to do that, and there's times where you don't have to do it that way, especially if something's ruptured, or but we don't get into the details of that. But
Yeah.
I remove the implant in the capsule,
Okay.
and then I use that their own tissue that normally some of it would just get tossed and thrown away,
Okay.
discarded,
Yeah.
and I use it and I move it and I sew it to the chest wall right behind where the new nipple position will be in more of the center of the breast, to give a little auto augmentation, a little more fullness right where you're lacking it the most after an explant. So
Good.
the advantage is that you're using your own tissue. It's there. There's no foreign body. Disadvantages would only be in that if you're not a good candidate, it just means you don't have enough tissue.
Okay.
So the best candidate is someone who has a full breast already, or a semi-full breast, and then doesn't mind becoming smaller. So
Right.
let's say they're a C and they don't mind becoming a B cup, or they're a D cup and they don't mind going down to a C cup. See what I mean?
Yes.
Because once you remove that implant volume, you're going to lose volume, and then when you do the flap and the lift, so I do the flap first, and then I do the breast lift around the flap.
Mm.
And then the lift could be either what we call a lollipop, which just means the scar goes around the areola and down the front. And so the scar looks like a lollipop. That's why it's called a lollipop lift, or a
Yeah.
vertical mastopexy, or an anchor where it just goes around the nipple, down the front, and underneath.
Okay. So very discreet. That's good.
Yeah, so there's no additional scarring to, it's the same as someone who just took out the implant and got a lift. The scars are
Mhm.
the same, they're
Okay.
identical. And the recovery is pretty much the same too, which is really nice, even
That
though
is
you're getting kind of that added benefit of the flap.
sure, sure. There's a growing awareness about breast implant illness. Can you talk about the symptoms and why some women choose explant surgery as a solution?
Sure. So, breast implant illness to me is a very interesting phenomenon.
Mm.
Reports started coming out as early as 2008 up until 2018, and it probably didn't start getting real attention and traction till 2018-19, right?
Yeah.
Because people get dismissed, and they say, if you don't have a good explanation, if we don't have a good and the symptoms are so vague, right?
Wow. Yeah.
Meaning they're systemic. It could be chronic fatigue, myalgias, arthralgias. It could be cognitive dysfunction, brain fog. So these are things that are very similar to like a rheumatoid arthritis or some kind of autoimmune disease, where you don't know exactly what's causing the systemic symptoms. Guess
Mm.
what? It's also very similar to toxicities, like mold toxicity symptoms, heavy metal poisoning toxicity symptoms. So it's very difficult to say that the symptoms are purely solely due to breast implants.
Yeah.
So someone really needs a very full comprehensive workup to rule out that their symptoms aren't caused by something else that can be treated, right?
Yeah.
And believe it or not, I've had patients where they wanted me to take out their implants, and this was earlier on when breast implant illness was more new. And
Right.
I actually didn't want to do that, meaning I encouraged them to see a rheumatologist, a neurologist, if they were having bad headaches and the kinds of neurologic symptoms,
Yeah.
the workups. And I can tell you, I had one patient in whom I performed her original breast augmentation. She wanted her implants removed because she thought her implants were making her sick. I didn't want to remove them because she was very thin and trim, and I knew how deformed it would look afterward if it
Mm.
wasn't her implants. So
Yeah.
the long story short, she went and sought another plastic surgeon who removed her implants. She didn't get better. And then she found out that she was having a very bad stress response to stressors at work and life. And once
Oh,
she got her whole lifestyle changed, she felt
yeah.
better. So she
Amazing.
actually came back to me to put him back in. Which I was grateful in that instance that I hadn't
Mm,
taken it out. But,
yeah.
she suffered. I mean, imagine how desperate you have to be to, actually do something that is going to make you look in your mind horrible, right? Because you did
Sure.
it to make yourself look better in the first place. And then,
Right.
but so we have to be very careful, is my point, meaning there are women who may truly have breast implant illness. And what I
Mm,
feel now it truly is it's a person's reaction to the silicone toxin in their body. It's a foreign body, right? And
sure.
so any foreign body, we form a capsule around it. And even like a facial implant that's made out of silicone, your body's gonna form a capsule or bursa around it because your body's very smart and innate, and it's gonna wall it off. So the same thing happens in the breast. The breast
Sure.
absolutely forms the capsule as a protective mechanism against this foreign body. But
Yeah.
I'm going to tell you something interesting. If you don't mind, I'm going to just share a little personal
Sure.
that made me really very empathic as well as sympathetic, which I've always been sympathetic, but very empathic towards patients with true breast implant illness. Now, part of the problem is it's so rare.
Okay.
That's why it doesn't get a lot of, that's why it's hard to study research
Sure.
wise in terms of numbers, because it's like, why have we done so many implant surgeries, whether it's for cosmetic or reconstructive reasons, and only a small number of women truly get sick from their implants, right? How do
Yeah.
you explain that?
Yeah.
Well, I can tell you, I unfortunately several years ago suffered from mold toxicity,
Oh.
and it was devastating for me. And
Mm,
what I found out was I developed something called CIRS, which stands for chronic inflammatory response syndrome. And
okay.
what that means was I was getting all the symptoms of like breast implant illness, right? Chronic fatigue, brain fog, some cognitive dysfunction because the mycotoxins cross the blood brain barrier. I mean, really devastating. It ruined me for a year. It was horrible.
Sure.
But my point is, guess what I found out with my diligent research and fighting through this awful um, disease was I had an HLA-DR gene mutation because I found the expert in mold toxicity in the country, and we did the gene testing. And guess what? It's very rare to have this HLA-DR gene mutation, but if
Mm,
you have it, you are susceptible to mold toxicity and get this CIRS and all these like very disabling symptoms, whereas someone else could be breathing in stachybotrys, right? And they barely
yeah.
have a cough. So why
Wow.
is that, right? Why is it knock someone like me, off my butt, and I'm
Yeah.
so fatigued and sickened, and someone else it doesn't affect? And I so
Yeah.
what made me think was, I bet you, and if I
Mm,
could have the funding to do this research, it would be fantastic, that women with true breast implant illness likely have some
mm,
kind of gene mutation that
right.
makes them more susceptible to that foreign body of silicone.
Wow.
I would bet my life on it, but of course, you'd have to do studies, randomized controlled studies. But it
That's,
makes sense to me, right? I mean,
it is
why
very,
would some women be so sensitive to silicone and others not? It has,
yeah.
likely it has to do with their genetic predisposition. I mean, there's other factors involved which makes it more complex. But
Yeah.
that is my best guess as to why some women truly suffer from it. So I have great empathy for the women who truly suffer from breast implant illness.
Mm, that's great information, Dr. Suzanne. And it totally makes sense. I hope that funding does become available to look into that more. It makes so much
Yeah,
sense.
because then if you look down the line, like what would be the goal? The best goal, Marcy, would be that if there were a simpler blood test that you could do, right, and send it off to get the genetic testing. Now, the problem right now is it's very expensive,
Oh,
and we haven't identified the gene. You have to identify the
yeah.
gene first, and then
Yeah.
you'd have to make the testing affordable. But can you imagine if before you decided to get a breast augmentation or a reconstruction, you could take some blood, see if you have the gene mutation, and if you have it, you say, you know what, you're not a great candidate for any implants. And if you don't have it, you may or may not be a good
Yeah.
candidate. Wouldn't that be amazing?
It'd be a lifesaver. I know someone who went through BIL and ended up having a hysterectomy, and like you're saying, if you could find that out before you even have your breast done, it would be a
Yeah.
game changer.
So that's my own, like, it's a little personal story, but I think it really led me to kind of this path, because now that I've developed this procedure, um I feel like I could help a lot more patients who truly have the breast implant illness. A lot of people just don't know that it exists. So the fact that I'm so grateful for you for interviewing me so we could help, get the word out that there's options. Now, let me talk real quick about fat grafting, because that's a real option.
For
The
sure.
problem is, what they don't tell you is, guess what? The,
What's
the best number we can give you about the take of the fat after it's been transplanted is about 50%. Now,
that?
that's not a great number, right? Meaning
Right.
50% of the fat may stay, 50% may go. Now,
Mm.
with that being said, there's techniques that can help the fat be better and take better. And so a lot of doctors will say, well, I get 80% take, I get 90% take because I do this technique. But, unless they've done studies and can really prove their numbers, right? So
Yeah.
if you're a super thin person, you may not have a lot of fat to transfer, right? I mean, there's some people say, great, take it from my tummy, my thighs, let's do this. So the problem is you can't guarantee how much of the fat will remain. The second problem is, so therefore you might need serial fat grafting procedures, which can be costly, number one, and number two, you have to undergo another procedure, right? Invasive
Right.
procedure. And then the last thing is, um, the pocket after you remove the implant. So for fat to take, meaning to survive long term, you can't just stuff it in an empty cavity where the old implant came out. It's going to die. It'll
Right.
necrose and get hard, and you're going to have complications. So you have to inject it into the viable surrounding tissue, which when you've removed an implant, and you have thinner tissues. For some people, thankfully, they have more breast tissue, but then if they have a lot of breast tissue, they might not need fat grafting, right?
That's, yeah.
So the challenge still remains in people who are very thin and have very thin tissues. So I will say that as a disclosure. That's why you'd have to come for consultation and make sure you're a good candidate for the procedure. We still
Yeah.
have a lot of challenges. Of course, this flap is not a panacea and cure all, but it's a great option if you're a good candidate.
Okay. Now, are there any lifestyle habits that can help maintain breast health as well as elasticity post surgery?
So, there's the general things that we hear about. People say, work out your pec muscles and your breasts will get tighter. That may be so for some people, but I can tell you, I do a lot of like bikini competitors, and a lot of times it just has to do with the skin elasticity and the quality of your breast skin as it ages, right? So, meaning they may have solid pecs and then their breast is saggy and droopy over the top of it. So, but meaning there's no harm in doing those things. It's simple. The other
Okay.
thing is that you may have heard of some herbal supplements that have something we call phytoestrogens in them, and that's things like saw palmetto, wild yams. Maybe even estrogen supplementation as you get older, or perimenopausal and menopausal.
Right.
Um, and then things that improve the quality of the skin envelope can be very helpful. And I just encourage people to use, whether it's some kind of oil, like a natural oil, to keep their skin very well lubricated and healthy. That can be helpful. If someone has a heavier, denser breast, I may recommend it that they may consider wearing bras at nighttime, or more supportive bras. It can be comfortable, something, just because if you think about it, just that weight over time, right? I mean, it's going to stretch out your skin.
Mhm.
Um, there's fancy things, but they're quite pricey, like microneedling with radio frequency, which it punctures little microneedles in the skin and then delivers radio frequency heat in the subdermal layers, that
Mm.
can cause tightening over the time. And then we can infuse exosomes and do things of that nature. But of course, those are costly things that you have to do a series of between 3 to 5.
Mm.
So sometimes sometimes there's not much you can do, because not only does our skin age, the Cooper's ligaments and some of the supportive structures in the breast just, again, they're made of, collagen, and there's elastin, and as these things age, they just droop. So sometimes you just need a breast lift.
Yeah, that's true. That's
But there
true.
are, those are the other, the things I mentioned before, are like more of the simple everyday things that you can just, try to keep them as perky as possible.
No, thank you for that. Uh, what advice would you give to women who are on the fence about removing their implants?
Um, I love having, I always allot at least a full hour for my consultations, because I love to talk to people, because everyone's different, and their tolerance for what they will have and not have done, very different. So if you
Mhm.
are at all open to another implant, meaning you're not in the category of I want these out at all costs, like, and I don't care how they look, or I'll accept how they're going to look afterward,
Mhm.
then my advice is we talk about replacement options, whether
Okay.
you want to replace with silicone gel, saline if you feel like it's safer,
Yeah.
if you need a lift or no lift. And we talk about it, because everyone's anatomy is so different. Everyone's experience with old implants is so different, right? Meaning,
Yeah.
there's, like I said, the women who've had their implants for 30 years and never had a problem. And
Yeah.
then there's the women who, after a few years, they get encapsulated, and it keeps
Mhm.
happening, and it keeps happening. And for whatever reason, their body is kind of, we call it, you'll hear people say my body rejects the implant, but it's more
Right.
just it's just, walling it off. It doesn't like it. That's
Okay.
true. So
Yeah.
it's having an inflammatory reaction, right? We don't
Yeah.
like that. So but if you're open to it, sometimes nothing can give you the volume and the perkiness that a new implant can, right? So
Yes.
so if they're at all open to that,
Mhm.
we'll talk about replacing implants. Now, if they're in the category of I absolutely want them out because I just don't want a foreign body in my body anymore, then
Exactly.
we can talk about the Qflap, fat transfer, lifting, no lifting, and the options there.
Wonderful. Wonderful. Now, Dr. Suzanne, how can listeners connect with you and learn more about the Q flap procedure?
Real simple. I have a couple websites. So if you just go to drqplasticsurgery.com, very simple, you can find me there. There's also palmdesertplasticsurgery.com, just because that website's existed even longer than the Dr. Q Plastic Surgery. But
Okay.
I have blog information. I have a lot of information. There's before and after photos. They can connect. They'll get the phone numbers to call for consultation, or they can just email and they can ask questions. On social media, I have 2 Instagrams. My professional is Dr. Q Plastic Surgery. And then I have a more just fun personal Instagram called Dr. Susie Q, which, if you
Oh, I
want to
love
see pictures of my adorable daughter Bella, because that's mostly what I post these days, you can
oh,
follow me there. And then, of course, Facebook, Dr. Q Plastic Surgery is my professional. And then I have Suzanne Quardt, ND, is my personal.
great. And Dr. Suzanne, you have so much information. I'd love to have you back on so
Oh,
we
I
can
would love
have a
it.
conversation.
Yeah, anything you want to talk about, I'm game. This is fun, and you're so delightful. So yeah,
You too. One of the reasons I
anything.
have you back on. Yeah.
Oh, thank you. I really,
Yeah.
really had a blast. I'm so happy we can get this information out, and I hope the more people that hear about it, hopefully the news spreads. And
Yes.
I really, really thank you for this opportunity, and it's so wonderful to meet you and your beautiful audience.
Oh, it's my pleasure. Thank you so much, doctor. All right, everyone. Take care. Bye-bye.